Hello, CPAC. Hey, my name is Peter Pitts. I'm a former FDA Associate Commissioner here to help. This is a panel about the power of choice. Now, the question is, isn't choice a good thing? I got news for you. This is not a no-brainer. There are a lot of people out there who don't think that we're responsible enough to have choice to make decisions for our own health care. There are a lot of people who don't believe in free market approaches to health care. And there are a lot of people that believe that Uncle Sam should be Uncle Sam, MD. This panel is about trusting Americans, about free market solutions, about trusting the American people. When the Part D drug benefit for Medicare, the part of Medicare that pays for prescription drugs, was being debated, it said seniors can make their own choices. And there were many people in Congress who said seniors couldn't possibly be trusted to make their own choices. Wow, were they wrong. Today, we are pleased to be joined by Governor Matt Bevin from the great state of Kentucky. And we're going to hear that states are the laboratories of invention when it comes to health care. And we're going to hear how he has unleashed the unbridled spirit of state-based ideas. But this is more than just about choices in insurance coverage options. It's about choice of medicines. It's about choice of physicians. It's about choice of hospitals. Let me ask you a question. Do you believe that we should import foreign price controls?
No.
Do you believe that we should import unsafe foreign medicines? No. That's right. And of course, as you know, if you like your doctor, you can keep your doctor. Will more options, more flexibility, more choices help and incentivize healthy young people to sign up for health benefits? I think that they will, and we'll talk about that. If you really want to bend the curve in healthcare expenses, we all have to buy into the system in ways that are best for us. So here's the big question. Are average Americans of all ages, small business owners in towns and cities, smart enough to make their own healthcare choices?
Yes.
Or should Uncle Sam take charge as Uncle Sam, MD? I'm very pleased to introduce to you Larry Foster.
It was a twilight evening in October 1981 in Toledo, Ohio, when a kind pastor was traveling home with his wife and children. His van was hit broadside by a semi-truck 4 times, and his life changed in a second. That can happen to any of us. His wife and daughter died instantly. His sons were in the hospital, one of them clinically dead, and he prayed for their survival. But of course, in the middle of that, a representative from the billing department at the hospital came to the waiting room and said, "We need to talk to you about how you're going to pay these bills." And when he said he didn't have insurance, and then he went on and he said, "God's going to have to help me pay these bills." She laughed just a little bit. And then he said to her, "I want you to put the word miracle on my folder." She did that. And weeks later, he was in the hospital talking about his bills. And she said to him, "Sir, I don't know who you are, but money has come in from all over America. And your bills have been paid in full, and there's money left over." It was in that moment that health sharing was born. From that dark night out on the road, that dark night of grief and despair, the light of people helping one another began to shine forth. And today, as we sit here, The health sharing has evolved from a neighbor helping a neighbor in one case to a business model that's all across the country that's driving a national health care debate and an option that serves over 1 million Americans. It's awesome. And I'm often asked, in fact, I've been asked since I've been here, what is health sharing? And my answer to that is it's simply a different approach, just a different approach to pay for medical care. It's not insurance. And may I add, we are proud not to be insurance. But it's a way that we match members' monthly contributions with medical needs within that group. Simply put is this: health sharing is a community of like-minded people that believe in the biblical principle of neighbor helping neighbor and the biblical principle of choosing to bear one another's burdens. The good news is it's open to people from all walks of life, every single one of us in here, for an example. And as so many Americans agonize over affordable health care, likely some of you have agonized over your health care decisions. And as we do that, the concept of health care sharing must be a part of that discussion. And we're going to talk about that this afternoon. It must be a part of it. To paraphrase what one industry expert said to me recently, he said, sometimes the best insurance is not insurance at all. But it's allowing faith-based alternatives to provide what insurance cannot provide, and that is a community solution. And I am proud this afternoon to stand here and to say to you that health sharing is a viable, exciting concept. It's a 40-year, almost 40-year concept that's prompting many people to walk away from health insurance as we know it, along with Obamacare, and it's often unaffordable premiums at unkept promises. Members often tell me, in fact, even here, I've had them tell me that the reason they chose health sharing, and specifically Liberty Health Share, is that it was the answer to the high cost of health care. And the numbers this afternoon are proof. The example I would give you is this: a Liberty family, the average cost per month is around $500. And today we're helping more Americans than ever. But members also tell me this: they chose health sharing because it's a community. And the Liberty community cares, and it shows. We have a team of nurses and provider and member advocates. They work with our members to address things every day, immediate and long-term physical issues. We encourage preventative care, wellness. We work closely with our members to improve their health, supporting them in their weight loss, supporting them as they're lowering their cholesterol and managing their diabetes. We even help them when they want to quit smoking. We have a pastoral staff that's available on a daily basis, and I often see them and I talk with them on a daily basis. They're offering prayer and spiritual encouragement to those that desire it. And our members are found encouraging one another as well. You know what happens when this all comes together? What it results in is this: a health-conscious community that helps keep costs down for all of our members. And we will go the distance to help our members get the health care solutions that they need. Health sharing is a uniquely American idea that's based on choice, it's based on freedom and access. And in today's marketplace, yes, and in today's marketplace, in the health marketplace where we are today, so many people, probably some sitting in this room, have been priced out of affordable health care options. Health sharing offers a real solution for real people. Are you all real people today? Let me hear from you. Real solutions for real people. And every day I hear stories from our members that say how this option changed their life. And I want to tell you about one of those today. Her name's Janine. Janine chose to become a Liberty Health Share member. Janine is self-employed, newly divorced mother. She had depended on her husband's insurance throughout her marriage. When her marriage ended, she realized that she would possibly have to give up the small business that she had built and loved in order to have a viable health care coverage in the state of California. She had no insurance. The cost of Obamacare was prohibitive. The day that she learned about Liberty Health Share from her friends who were in a very similar situation, small business owners, she told me this: Larry, it was the day that I found my lifeboat. And Americans now more than ever, probably some sitting in this room, have family and friends, more than ever need a lifeboat in the sea of confusion called healthcare. You need to know today that there are alternatives there are alternatives in the healthcare options that you've been given. And stories such as Janine's confirm that Liberty Health Share is one of those options. Health sharing in general is one of those options, and we're at the forefront of a revolution in healthcare. In that sea of confusion, complexity, Liberty Health Share is one great option, bringing clarity and peace of mind in the midst of it. Here's what I'd invite you to do today. If you want to stay up to date with our revolution in healthcare, follow us right now on Twitter at SharingLHS. Thank you.
Ladies and gentlemen, the smartest person on the panel, Doug Badger.
Thank you. Not sure if I'm the smartest or the most boring. I hate to follow that. Larry, that was just a wonderful presentation. Thank you. You know, the healthcare debate gets pretty complicated, and it can be hard to follow at the federal and even at the state level, but it really comes down to this. Who do we want to make our healthcare choices? Do we trust those in Washington who believe that we will be better off if they restrict our choices, tell us what kind of coverage we have to have, and then make us buy that coverage or pay taxes for that coverage? Or do we trust ourselves, our neighbors, our communities to be able to deliver new options, new ways of making sure that all of us have access to the best health care on earth? All of us were disappointed by that vote in the Senate back in July of 2017, in which Congress failed to keep its promise of overturning Obamacare. But if there's one thing I want to really drive home to you, is that that was not the end of this debate. That was not the end. Thank you. Of campaigning for a consumer-centered system. And I just want to talk to you about two things that the Trump administration has done just in recent months to make affordable health care more widely available to individuals and small businesses, even within the constraints of Obamacare. Now, a lot of conservatives don't know about these things, but I will tell you, the people on the left do, and they're hard at work in Congress and in the states to try to nullify these very important decisions. So we're going to talk to you about two insurance products right now that are available. One's called a short-term limited duration plan. It's a real mouthful. But what it means is an individual health policy that is not subject to federal Obamacare regulations. And guess what happens when you exempt certain policies from those regulations? The first thing is the premiums are lower by 50 to 80%. The second thing that happens is that instead of getting a choice of one or two insurers in the Obamacare exchanges, there are in many states literally dozens of insurers offering different products on the marketplace. Now, you need to be a smart consumer. Because these aren't federally regulated, you need to read what's covered. You need to deal with an online broker or a broker in your community to make sure you understand what it is you're buying. The insurance company can charge you more based on your medical condition. They're not right for everybody because no single insurance policy is right for 330 million people. But they're right for millions of people, and it's something you should be aware of. The second thing is for people who have small businesses, people who are sole proprietors, a husband and wife who have a business, for example, in which they're the only two employees, or independent contractors. All of those people right now are forced into buying very, very expensive Obamacare policies. And so what President Trump did, and these regulations, is amazing, only took effect in September of last year. And what they do is allow small businesses to band together, yes, even across state lines, and get the purchasing power of large businesses when they buy insurance. In these few short months that these have been available, we've already seen chambers of commerce, for example, around the country forming these plans called association health plans. Once again, premiums are much lower, by 23 to 29%. The left likes to tell you that this is junk insurance, but studies that have been done of this are saying that these are good, high quality, more affordable policies. Why is that important? If you run a small business, or you know someone who runs a small business, you'll know that their number one issue is providing health coverage for their employees. Millions of businesses are just not able to do it. Now they have a new option. Now these two exceptions to the Obamacare regulations, that's not a solution. There's work for us to do. There's work for Congress to do in order to restore our system to one that is run by consumer choice rather than by government bureaucracies. But folks, we have something today that a year ago we didn't have. We have new options for individuals, new options for small businesses. We need to make ourselves aware of it, our neighbors aware of it, and really take advantage of these innovations. Thank you so much.
Thank you, Doug. Our next speaker is Dr. Mark Segal. You've seen him on Fox. I know he looks taller on Fox. He is also the smartest person in the room, who says he can get across all of his talking points in 1:30. We'll give you a little bit more than that, Mark.
The smartest person in the room has got to be Governor Bivens of Kentucky, because I want to buy a farm down there. So I need to be very, very complimentary. We're in the post-Obamacare era. Now, this was originally billed as a talk on how American healthcare is already great. And I want to tell you, first off, how it is great. It's great because we're entering a time of great innovation, of personalized solutions, and you've all been hearing about these things. So if we're up here trying to solve problems, I want to talk about the great part first. You wouldn't believe what's happening in cancer treatments. Maybe some of you know this. You're all America's patients out there, or will be someday. What we're bringing, we've completely revolutionized the cancer field, and we're developing personalized solutions based on immunotherapy and genetics. We know everyone's genes now. We're learning what to do about it. But here's the problem. The problem is that insurance was developed in the 1930s, initially by Blue Cross, as something that you need in case a catastrophe happens and you have to be rushed to the hospital. Well, the whole medical system has changed since then. And I can tell you, as someone who works in a post-Obamacare office, that Obamacare moved things in the wrong direction. Why? Here's why. Peter Pitts already said you don't get to keep your doctor, but guess what you do get to keep? Your deductible. That you get to keep. And you know what that does to me? That means you come to see me and I want to order an ultrasound of your thyroid, but you haven't met your deductible, so I can't figure out if there's anything wrong with your thyroid. Now, people aren't as interested in the strain that doctors are under as they should be, because the strain that doctors are under, and the real untold story here, is not even Obamacare. It's the simultaneous introduction of mandatory computerization in the doctor's office. You know what that did? That put us in a position where we had less face time with our patients, where we're spending all of our time documenting, where you're lucky to get 2 minutes of our time. And it's in those 2 minutes, or what should have been 20 minutes, where you say, by the way, doc, on the way out the door, by the way, doc, I have chest pain. And then I would then try to figure out what's causing the problem. So that's decreasing quality of care. And the more government overreach you have, the more regulations you have, the more you got to document here, here's meaningful use, we're paying you less for doing more. The more that this occurs, the less we have a model that fits the innovation of the future. So what is the solution? It's choice. Why? Because the original idea that went with Obamacare was I call it a Ponzi scheme. Let's get everybody to pay into a system that takes care of the sickest people. Well, that sounds good, except the young people rebelled. They said, we're not taking this insurance. We're not going to pay a fortune for 50 years from now when I get diabetes and get heart disease. So they opted out, and 6 million of them a year took the penalty. Now we got rid of the individual mandate, which is a great thing that it's gone, and we can replace it, as Doug was just saying, with more choice, with association plans, with skinny plans, with health sharing, which was already here, but that can be expanded. The more choices you have, the more options you have, the more you might be able to bring to the doctor's office something that I can work with, something that I'm not stuck with a big whopping deductible. The same thing ends up being true for prescription drugs, by the way. We're stuck in a situation, to give you insulin for example, where the cost of insulin, the latest insulins, which are terrific, are 10 times more what they were in the 1990s when they came out, some of the newer insulins. What's the solution to that? Well, we have older insulins we're not using. We have biosimilars, which Dr. Gottlieb, the head of the FDA, has told me are about to come on the market that will be a lot cheaper. We have more options, more choice, which leads to more competition, which leads to lower prices. Here's another thing related to that that I think is hugely important. The administration has a proposal where the middleman, the pharmacy benefit manager, who takes about $100 per prescription out for profit, and I'm not judging that, but I'm telling you the rebates don't go to you. You go to the pharmacy, and you're hit with it in a copay. So you say, well, who cares what the list prices of the medicines are? Well, if they're high, your copay is going to be high, and you're going to end up paying more out of pocket. So I want the rebates to go to the patients. And I also want you to know when you can pay less, you can pay less for cash than your copay is for another drug nobody's even telling you about. So the pharmacist tells you now. And there's price transparency more and more that we didn't have before. So I'm in favor of all of those things, and we have to go back to a doctor-patient-centric system where you get to talk it over, not to a computer. Thank you.
Ladies and gentlemen, from the great state of Kentucky, Matt Bevin.
Thank you very much. Thank you, CPAC. It's good to be with you. It's awesome. It's late in the afternoon. It's been a long day. You've had a lot of great people, and you're still packed in here listening to a bunch of people talk about health care. You are die hard. That is awesome. And I'll tell you what, really and truly, I'm coming from a slightly different perspective. I'm not here specifically to talk about health care options, other than to say that as the governor of a state, I'm a big believer in the fact that this is indeed a government of and by and for the people. But frankly, for that to work, we the people have got to be engaged, and we the people have got to be involved, and we the people have got to let our voices be heard, and we're doing it literally through things like CPAC, and so thank you for being here. Grateful to you for that. It's interesting, though, when you talk about this, I mean, the of and by and for the people, though, has been increasingly, in recent years, seemingly hijacked a bit. And it seems to be increasingly more of and by and for a few. But guess what? It happens because we have abdicated our responsibility. And if we allow it to be of and by and for a few, and if we allow a handful of people, be they in Washington or wherever, to make decisions that are then foisted down upon us and become what we are forced to live by, it's going to cover more than just health care. It's going to be what we have in our schools in the form of a common course, good in theory, bad in policy. One size does not fit all. Soon enough, people may be trying to tell us who does or doesn't go into which bathrooms and locker rooms in our schools. People may start to decide what dictates water and moving water and what the federal government has jurisdiction over, even if it's a puddle in your driveway. Literally, these are the kind of things that our apathy and abdication of our responsibility as free citizens will ultimately lead to if we allow it to. And so as the governor of a state, I'm blessed. This is the first political job that I've ever had. I've never been in government. So I come at this from a perhaps non-political perspective, but I think this is healthy because, truth be told, in large measure, this is the same perspective that drives you. We've got a tremendous amount of responsibility for ourselves and freedom that we have been blessed with. But we need to use it wisely. But touch quickly on one thing. First of all, let me simply say this. This idea that government needs to be involved in health care, but when I've really pushed back on the most credible argument that I've heard is that, well, they've got to because it touches every single human being every day. Every single day, almost with no exception, every one of us is somehow affected by the healthcare system, and our health is a daily, regular part of our lives. True enough. You know what else touches us pretty much every day? Pretty much a daily part of every American's life? Your car. Your car is. But guess what? The federal government doesn't dictate to you what kind of car you're going to drive. Doesn't say whether you're going to buy a new car or a used car. You've managed somehow, God bless you, you've managed to figure it out for yourselves. You have figured out how to buy yourself the car you want, you new or used. You've managed to figure out how to finance that, and guess what? You use that sometimes more regularly than you use your health insurance. So if we can trust you for those kind of daily decisions, why not this? The more the government gets involved, I would defy you. Can you think of anything that the government has taken control of, anything where they provide a better alternative than the private sector and free choice? There really isn't. I mean, literally, where there is a private sector choice, there really is no example of the government doing a better job of it. And so given that, what I'm a proponent of as a governor, and I don't think I'm alone in this, is return the responsibility to the people. The 10th Amendment is a powerful amendment. The 10th Amendment says clearly, the 10th Amendment states very clearly that those powers not given to the federal government are the responsibility of the states and of the people. Simple as that. We're it. So in Kentucky, when I was elected, and I'll make this tight, we had expanded Medicaid, which was never intended to be for people like us, able-bodied, working age, no dependents, but now it is. Millions of people, including 500,000 more people in Kentucky, able-bodied, working age, no dependents, now getting free health care at a cost that is frankly prohibitive and unable to be sustained. So I came up with this crazy notion that maybe people who are receiving free health care should be expected to do something in exchange. It's a crazy concept. Something small. So again, long story short, Kentucky was the first state to ever be given permission to require work and or volunteering and or education and or service and or taking care of others and or training for jobs that exist of someone 20 hours a week in exchange for the receipt of Medicaid benefits. Again, not too much to ask, and I've been called everything under the sun, as will all of you. But I want to make very clear before I sit down and we open this up to some questions. This doesn't come from a position of sympathy. I'm offended by liberals who look down on people who are poor. I was such a person. I never had any access to any health care in my life until I was an active duty Army officer in my 20s. It was the first time I ever had health care. I grew up well below the poverty level in dollars. We didn't have access to the very things we're hearing about on this stage. So I'm not coming at this from sympathy, it's from empathy. I understand that world, and I understand this. There is dignity in work, there is dignity in doing for oneself, and there's dignity in being given that opportunity, and the expectation that we seize that opportunity in order to make our own versions of the American dream come true. And the liberals who look down on people like I was, and so many are still, I consider that a level of bigotry that's unacceptable. To look down on poor people who are financially disadvantaged with the scorn that these somehow rabble are unable to rise up, that they need to be taken care of by the government because they can't possibly pursue the American dream without government deciding things for them, is nonsense. We deserve better than that, not only in Kentucky, but in America.
Dignity and respect and trust sounds like what government should give its people to make their own choices.
Absolutely. I mean, you think about this. What did our founders understood? That the government does not give us the vast majority of things that we are blessed to have, including those certain inalienable rights that were defined and codified in our Constitution. The right to life, the right to liberty, the right to the pursuit of happiness. Not a guaranteed outcome, not a guaranteed universal wage, and not all of this nonsense. The fact, honestly, Peter, that concerns me perhaps the most is how many young people, and this is why, again, I'll keep thanking you for the umpteenth time, I'm encouraged to see young people who do not believe that socialism is better than capitalism.
Hear, hear.
I'm encouraged by that.
Well, Larry, kind of taking off on the we the people concept. I mean, about 1 million people in the U.S. use health sharing. You know, it's not insurance.
Right.
Who is it right for? Why is it a viable option that's going to propel people towards better health?
Well, to answer that, if you look around this room today, who is it for? Look around, it's for people just like sitting right here. All around the country, it's that. It's a group of people that are interested in not being a part of the insurance system of profits, but people. It's a group of people that say we want to talk about care, not necessarily cost. We want to talk about control. We want to talk about making choices. It's about people who believe in the calling to help bear one another's burdens. People like that are sitting here and around the country. It's a great fit for individuals that believe in that.
And I love that word calling, because Mark's a physician, he has a calling. Doug is devoted to smart public policy, that's a calling. Governor Bevin is devoted to the folks in Kentucky, and that's a calling. Mark, relative to healthcare options and trusting people, trusting patients, how does that help you be a better physician?
I think the dynamic between doctor and patient, the doctor-patient relationship, is at the center of the healthcare model, and it's unfortunately been interfered with by government being in the room. By now, if we, God forbid, got Medicare for all, we'd have to make 1 million phone calls to get approvals from on high, something out of Kafka.
I mean, has government ever helped you become a better physician?
No, all government does is restrict me and tell me what I can't do. It's always telling me what I can't do. Now, to the point that was just made, I want to add something, which is that it's a health model we need, not a disease model. And what does that mean? And this is where you're going with health share, which is we should incentivize people getting up and exercising, people getting a more plant-based diet, people eating a Mediterranean diet. We have 2 out of 3 people in the United States overweight. We have to work on the obesity epidemic here. That leads to diabetes, that leads to heart disease. So we're focused so much on illness, which of course we should be. We have to protect our sick people, and we need to cover pre-existing conditions, but we have to figure out a way to reward health.
Larry, one thing that appeals to me about health sharing is that many insurance plans, kind of traditional insurance plans, will give you money towards smoking cessation programs, or they'll defray your gym membership. So it's a little bit of a carrot. But from what I understand, and health sharing does that as well, but there's also a stick.
There is. It's called accountability. There is still accountability in America. Do we know that? And in our health sharing program, if you are part of the preventive health, if you're part of the health and wellness program regarding weight, diabetes, or quit smoking, our coaches are going to work with you to do that. And if you don't do that, there are consequences. You can no longer be a part of the program.
Doug, when Secretary Azar and HHS proposed the modification to the thin health plans, they just took a beating. They were excoriated by the other side, saying this is going to sell people fake policies, it's going to lure people into bad programs, and that hasn't happened.
No, it hasn't, but what they typically say is if you're not in this insurance program designed by the government, then you have junk insurance. Anybody here ever had, with an Obamacare policy, ever had a surgery, ever had to see a doctor? The Kaiser Family Foundation, not a conservative group, issued a report this week that said Obamacare plans deny 20% of medical claims for inpatient services. 20%. In the state of Kentucky,
1 in 5.
It's 40%, twice that. So don't let them tell you that these other policies are junk insurance. The junk insurance is the insurance that is chosen for you by the government. The best insurance is what you choose for yourself and your family.
And I guess when the facts don't match up with your rhetoric, what you do is ignore it.
Right.
Governor, in Kentucky, you've gotten a lot of CMS waivers, do some pretty creative things. When you met with your healthcare staff, and they said, look, we can do things differently here, was there a moment that you said, well, maybe we should just do what Washington tells us to do?
No, in fact, quite the opposite. I don't know if I made myself clear earlier, but not even a little bit. To me, everything is wrong if we fall like so many sheep in line, like lemmings, and follow bad policy. I think everything you're hearing here is the greatness of America. And the idea that you even have to go to CMS, that you have to do Mother May I to get waivers and exceptions to bad policy. You come up with a good idea and you have to go beg and ask permission to be able to try a good idea at the local level is insane to me. And so one of the things, to even what was noted here, that we're doing in Kentucky with this health care waiver. And first of all, I'm asking CMS and HHS, anything they approve to Kentucky, let any other state do the same thing and vice versa. Why reinvent the wheel? But it encourages people to be engaged. And this is what healthy people are: engaged people. People that are engaged in their own communities, in their own health outcomes, who have a vested interest in what they're doing, where there is accountability. These people tend to be healthier people, mentally healthier, physically healthier. And at the end of the day, it's not about coverage. So many on the left want people to be covered, but it's not about coverage, it's about whether or not you're getting better health outcomes. That should be the purpose of all of this.
Here, here. Mark, quickly.
I want to add to that I think the key word is access. The governor is right. You know, it's not about coverage. It's what happens if your network is narrow. Even if Obamacare does approve your request, you're not going to get to see the doctor because they're not in the network. The hospital you're used to going to is not in the network. The drug that you need is not approved. So it's a diminishing of access to the actual care that leads to the better outcome. That's the problem. Government promises or insurance company promises, but what's the actual health care that you get access?
So, Larry, you're the solution. You're one of the solutions here. You're the representative of a solution. What do you tell a family or a healthy young person who's been failed by their Obama policy? Low premium, high deductible, they can't get covered. You want them to move into health sharing. What do you tell them?
I tell them now's the time to do it. Tell them that they don't have to be a part of the system. They can be a part of a system that is about people and not profits. And if they come in and start right now, they can work with a group of people that are going to see them and go the distance, really, to provide them the solutions, the technology that will provide them an opportunity to look for the lower cost. And look, not just lower cost, but the quality that goes along with it. The people that are going to walk alongside of them. They're not just a number. And in any large insurance organization, employer-based coverage, they're a number in part of that. And so when I think of the young people coming out now, don't join the system. Join a program like ours and take a difference, make a difference.
Okay, Doug, we have 1:08 minutes left. Take a little bit of time and talk about, is the only way that the federal government can expand options and decrease costs and increase access by getting out of the way?
Absolutely getting out of the way. And I'll tell you, there's a group of us that have been involved for over a year in trying to develop an alternative to Obamacare. And here's what we came up with. The Obamacare pipeline goes from the Treasury Department to the insurance companies. Tens of billions of dollars a year. What we're saying is the pipeline should go from the federal government to the states. Let governors like Governor Bevin design programs that are centered on consumer choice, on the doctor-patient relationship. If you want to learn more, healthcarechoices.org. You'll see a lot about it. But yes, the federal government is not the solution for healthcare, it's the problem.
Governor Bevin, last word is yours.
Let me just simply say this. A number of you see this little button I'm wearing. It's a pair of scissors cutting through red tape. That's what this is about. Let's get government out of the way. Let's free the people up. It's not that complicated. The state motto in Kentucky is united we stand, divided we fall. As conservatives, as Americans, as people who believe in liberty and freedom, let's stand together. Let's stay united, because divided we'll fall.
Blue Moon of Kentucky, keep on rising. Ladies and gentlemen, thank you very much. Panel, thank you very much.
Good job, guys.